Hello there. If you are a therapist who is about to provide therapy to a client suffering from or experiencing poverty, this is the right video for you. In this video guide, Anne and I will be providing you with the background of clients experiencing poverty, the research and statistics involving poverty, and helpful interventions and practices to use with this client base. We would like to bring to light a staggering statistic. In 2022, 11.5%, or about 38 million people in the United States, were impacted by poverty. And last year, in 2023, this percentage only decreased to 11.1%, involving roughly still 36 million people. That's a really big number of Americans affected by poverty. But what does research say about it? Well, research shows that out of the 36 to 38 million Americans living in poverty, women, and specifically women of color, are significantly more impacted by poverty than men. Also, it is important to note that this number does not account for any unhoused individuals or children. With that being said, children living in poverty are 2 to 3 times more likely to develop mental health conditions or have increased risks for chronic diseases such as heart disease, hypertension, and strokes than those living in more economically stable households. This population also has greater exposure to both acute and chronic stress that can lead to a long list of undiagnosed and untreated forms of depression, anxiety, PTSD, and so forth. But what qualifies as poverty? Let's dive into that complex answer. A general search in Wikipedia defines poverty as a state or condition in which an individual lacks the financial resources and essentials for a basic standard of living. But poverty is defined a little different within psychology due to looking at it through the lens of an operationalization. According to the World Health Organization, poverty is a major contributor to mental illness, stress, suicide, family disintegration, and substance abuse. Some have asserted that poverty is a social injustice that society and its institutions have created and maintained. The more socialized umbrella term for poverty is socioeconomically disadvantaged, which includes groups that do not meet the threshold above low-income households. This group includes underserved or house insecurity individuals, socially disadvantaged, or household recipients of government assistance, such as welfare, and so forth. As a therapist, it is important to become familiar with the social dilemmas presented when working with a client experiencing poverty. This means that finding resources as a routine in your therapy prep will be incredibly important so you can have them readily available to your client for hopefully a seamless transition from your office to the next. Additionally, becoming sensitive to behavioral and relational patterns of individuals experiencing poverty and growing aware of the cultural values will increase the likelihood of building rapport. Lastly, as a therapist, knowing that the first time a client is sitting in your chair may also be the last time. It can be challenging, but providing therapeutic support, such as empathetic listening and having readily available resources, can be the most effective support for the client. Our responsibility is to practice what is in the client's best interest and let the client be the expert. Therefore, it's imperative that as a therapist, you acknowledge the overarching oppression they already face in their lives. A tool that can be helpful for you is the diathesis trust model that suggests psychological disorders arise from the interaction of an underlying vulnerability, diathesis, and external stressors. An individual may have a predisposition to a disorder, but it's the combination of this vulnerability and adverse life events that triggers its manifestation. Specifically, poverty-related stressors such as poor health care, housing problems, limited access to basic resources may incite heightened forms of psychological stress and dysfunction. So regardless of causation, it is clear that there is a correlation between poverty and mental health problems. With that being said, there are 6 main challenges that as a therapist you should become familiar with. Challenge 1 looks at financial issues with food, housing, spiritual, and financial insecurity. Since counseling is more consistent with middle class values, this may be new to you. The second challenge includes transportation issues, where clients have a hard time finding consistent transportation to get to and from your therapy office. In most cases, clients rely on family and friends and public transportation, which can present a potential issue of tardiness to their appointments. This is not the client's fault, as they may have barriers combined that ultimately result in unmet treatment needs. The third challenge can present as an authoritative imbalance where there is significant difference in power between the therapist and client, which can lead to issues such as the negative authoritative figure perception from the client and confidentiality misunderstandings, which may have been impacted from previous sensitive conversations without the bounds of confidentiality. The fourth challenge is systemic marginalization. That includes complicated, multidimensional impacts of economic injustice. There is also the issue of classism or social class oppression that looks at the availability of services and resources that may not be available to people experiencing poverty and is maintained by institutional and cultural classism. Challenge 5 is about healthcare inequities where people in this population may not have comprehensive healthcare plans and that there are limited culturally informed clinicians within those plans if they do have some. Now, the last challenges and obstacles include stereotyping and labeling behavior of persons experiencing poverty. These labels with negative connotations can include welfare queen, which can unfortunately be used to label the head of the household mother, raising 2 children and utilizing government assistance like EBT or unemployment financial assistance. A very common label is also drug addict or alcoholic, because people experiencing poverty do use substances to cope with the chronic marginalization and need to survive. On that note, it is extremely important to highlight the consideration of how low mental health literacy and mental illness stigma influence clients' knowledge, attitudes, and belief toward mental health treatment. Individuals experiencing poverty are stigmatized as irresponsible, morally defective, aggressive, disruptive, and more. It is important to keep in mind that most traditional therapy settings, as we mentioned earlier, are normally geared towards middle-class clients and values than poor people in U.S. society. Clients in poverty can also arrive to sessions late, hungry, and fatigued. And finally, research in other areas demonstrate that people in the helping professions tend to view people who are experiencing poverty in a way that diminishes the professional's belief in the client's ability to succeed.
There are multiple ways and solutions to make therapy services more comfortable and accessible for this population. Effective interventions include solution-focused brief therapy, motivational interviewing, mindfulness-based interventions, and the CARE model. SFBT, or Solutions Focused Brief Therapy, zeroes in on the therapeutic relationship, is low cost and an effective short-term therapy conducted in an average of 6 sessions. This therapy places a great emphasis on client successes, solutions, reframing, and more. It uses techniques such as exceptions to the problem, specification of goals, and the miracle question. The counselor and client should try making small changes in any area, as a small change in one area often leads to change in another. Another important aspect of SFBT is flagging the minefield, where counselors assist individuals in recognizing the potential obstacles or barriers in their way. Moving on, motivational interviewing facilitates behavior change through exploration and resolution of ambivalence, and it focuses on being optimistic and hopeful. It also uses the principles of empathy, discrepancy, self-efficacy, and resistance through ORS, open questions, affirmations, reflective listening, and summarizing. It is open-ended questions-based and affirms and validates clients' positive qualities and is an efficacious intervention that enhances the client's motivation to change. MI also expands on the long-term vision of the client and finds values in alignment with the positive impact that they seek from therapy. Mindfulness-based interventions are strategies that involve mindfulness, relaxation, breathing, meditation, and yoga. Short-duration mindfulness-based interventions in CBT and clinical settings are recommended to reduce stress and depression. Interventions with a duration of 1 to 3 months had a greater effect in reducing stress than those with a longer duration, and counselors should concentrate on mindfulness strategies to help socioeconomically disadvantaged people reduce stress, depression, and improve their mental health. Now, the last effective intervention is the CARE model, which is a social justice and humanistic intervention that emphasizes cultivating a positive counseling relationship with poor clients, emphasizing their unique realities, and working to remove barriers to future successes and well-being by building on their strengths. It is grounded in the belief that people are dynamic and have an innate propensity to healthy growth and purposeful living. So what does the CARE model mean? Well, this model highlights the need to cultivate relationships, acknowledge realities, remove barriers, and expand on the strengths of poor clients. Working with people living in poverty requires relationship building efforts such as acknowledging the barriers that impede many poor people from actualizing their untapped human potential and communicating a genuine sense of respect for the forms of resilience that their clients routinely manifest. When it comes to acknowledging realities, it is important for counselors to assess the reality of the culture they live in and the American dream. While the American dream has been proven to be a myth, it still remains an idea largely perpetuated by the dominant cultural group in the United States. Knowing this, counselors are able to help poor clients identify various forms of internalized oppression and self-blaming that contribute to their psychological distress. Counselors should also remove barriers by advocating for flexible approaches and creative strategies, such as in-home counseling, securing public transportation passes, and the provision of free daycare services for children when the clients are receiving counseling, and much more. If counselors fail to explore how these barriers adversely affect clients' lives, then many poor clients are likely to view counseling as irrelevant to their immediate needs. And for the last letter, for E, which is expanding on the strengths of poor clients, counselors should focus on the primary and secondary coping strategies. Primary coping strategies are manifested in people's problem-solving abilities, emotional regulation, and an internal locus of control orientation when presented with stressful life events. Secondary coping strategies are reflected in people's acceptance of contextual circumstances, their ability to restructure their thinking about their problems or cognitive restructuring, and positive thinking. Moving forward, when counseling clients experiencing poverty, there are some additional areas that have to be addressed. It is important for counselors to use strategies to promote clients' continuation of services, such as home-based counseling, group formats with childcare, assistance in securing or maintaining housing, and preventing the criminalization of poverty. Many individuals living in a culture of poverty are also noted to demonstrate an unusual level of resilience in the way that they cope with the multiple stresses that they live with. They exhibit a broad range of adaptive coping strategies, high self-esteem, effective problem-solving skills, and other intellectual abilities that underlie their sustained resilience. Here is a page of resources for patients that you can use. This list includes resources aimed at helping people living in poverty improve their overall well-being and includes the 988 Lifeline, which is a free suicide and crisis lifeline that can be utilized through phone call, text, and online messaging. It also includes Medicaid, temporary assistance for needy families, Head Start and Early Head Start programs, and children's healthcare insurance programs. And with that, we conclude this video about working with people experiencing poverty with some encouragement and positivity. Listen and work with them empathically. Remember that each client is unique, and make sure you refer back to this video for help. Take a deep breath, and good luck. You can do this!